This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Maternal Newborn, Part 1.
Welcome to 24/7nursetutors.com. My name is Tim, and today we're going to discuss maternal newborn. Let's talk about positive signs of pregnancy. How does a woman know she is pregnant? Well, one of the first signs some women notice is, can you guess? Yes, her period is gone. And so as a nurse, you may have a very excited client or a very sad one. Some may be super excited about the baby while others are quite sad. A positive pregnancy test is usually indicative that a baby is on the way. It is based on the presence of HCG levels. There are other conditions that can elevate HCG levels. Other signs of pregnancy are Chadwick's sign, which is a darkening and bluish color of the cervix, vagina, and vulva. Goodell's sign is the softening of the vaginal portion of the cervix. And Heger's sign is the softening of the uterus isthmus. Let's discuss gravidity and parity. Gravida means a woman who is pregnant. Gravidity is pregnancy, or the number of pregnancies regardless of the outcome. Parity is the number of pregnancies in which a fetus or fetuses have reached viability. This is the number of deliveries, not children, occurring after 20 weeks gestation. Whether a fetus is born alive or stillborn after viability is reached does not affect parity. So what is viability? Well, viability is the capacity of the fetus to live outside the uterus. It is usually considered about 20 to 24 weeks since the last menstrual period or a fetal weight greater than 500 grams. Other terms we might discuss would be multigravida. That's a woman who has had 2 or more pregnancies. Multipara is a woman who has completed 2 or more pregnancies to the stage of fetal viability. Nulligravida is a woman who has never been pregnant. Nullipara is a woman who has not completed pregnancy with a fetus or fetuses who have reached the stage of fetal viability. Primigravida is a woman who is pregnant for the first time. Primipara is a woman who has completed 1 pregnancy with a fetus or fetuses who have reached the stage of fetal viability. The GTPAL approach provides detailed information about the woman's pregnancy history. G is for gravidity. That's the number of times a uterus has held a pregnancy. T is for term pregnancies. Those are pregnancies that have gone to full term, generally 37 to 42 weeks. P is for preterm pregnancies, when a fetus has made it past the stage of fetal viability, generally 20 to less than 36 weeks. A is for abortions, either elective or spontaneous. This is less than 20 weeks. Spontaneous abortion can also be called a miscarriage. And L stands for living children. Remember, twins are 1 pregnancy. Let's discuss pregnancy dating. Nagela's rule says to add 7 days to the first day of the last menstrual period, add 1 year, and then count back 3 months. McDonald's rule is the fundal height. It's the week of gestation. For 24 to 36 weeks, the fundus continues to grow 1 centimeter for each week. A sonogram, usually done at 7 to 13 weeks after the last menstrual period, is the most accurate for dating pregnancies. Let's discuss pregnancy and nutrition. Nutrition is very important during pregnancy because it will affect the size of the baby. Weight gain during the first trimester is expected to be 3.5 pounds, then 1 pound per week thereafter, for a total of 25 to 35 pounds. Folic acid is an important addition to the nutrition of the pregnant client to prevent neural tube defects. Iron supplements must also be given at 30 milligrams per day. The pregnant client will need an additional 300 calories per day, due in part to lactating, which requires 27 to 2800 calories per day, and also 3000 cc's of fluids per day. Postpartum should be a well-balanced diet consisting of 2200 to 2300 calories per day. Can someone please tell me some of the danger signs of pregnancy? Well, these symptoms are very important, and as a nurse, we need to teach the mother when she leaves the prenatal visits to watch for the following signs. If they occur, they need to call the doctor immediately. Here are some danger signs: visual disturbances, persistent abdominal pain, vaginal bleeding, change in fetal movements, rupture of the membranes, swelling of the fingers, face, or eyes, a headache, painful urination, persistent vomiting, chills, and fever. Let's discuss amniocentesis. Aspiration of amniotic fluid done from 14 weeks of pregnancy and on is amniocentesis. The risks include maternal hemorrhage, infection, Rh isoimmunization, abruptio placenta, amniotic fluid emboli, initiation of labor with possible spontaneous abortion. You must obtain informed consent. Instruct the client to empty their bladder before the procedure. Later in the pregnancy, they may need to fill their bladder at 14 to 17 weeks. Prepare the client for the ultrasound, which is performed to locate the placenta. Obtain a baseline vital signs and a fetal heart rate. Monitor for every 15 minutes. Position the client supine, wedge under the hip in late pregnancy. Instruct the client that if chills, fever, leakage of fluid at the needle insertion site, decreased fetal movement, or uterine contractions occur, she is to notify the physician or healthcare provider. Triple marker screening are screens for chromosomal abnormalities. It increases the detection of trisomy 18 and 21. Maternal serum samples are taken between 16 and 18 weeks gestation, and the results are considered positive if the maternal serum AFP and estriol are low and if the HCG is high. If testing is positive, the woman should be offered additional testing such as amniocentesis for karyotyping and additional ultrasonography to look for physical characteristics associated with the chromosome defects. A fourth marker, inhibin A, is being evaluated to determine if its use can increase the accuracy of multiple marker screening for identifying trisomy 21. Inhibin A is elevated in the fetus with Down syndrome. Levels do not rise until the second trimester, limiting its usefulness as an early screening tool. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.